Namaskar. A very warm good morning to all. On behalf of National Coordination Center for Pharmacovigilance Program of India, Ministry of Health and Family Welfare, Government of India, we feel privileged to have the pleasant task of welcoming the distinguished guests, higher officials, dignitaries, and my dear colleagues to the valedictory ceremony of Second National Pharmacovigilance Week with the theme of encouraging EDR reporting by patients. Now, may I request Dr. Jayaprakash, Senior Principal Scientific Officer and Officer in Charge, Pharmacovigilance Program of India, IPC, for the welcome address.
Thank you, Dipti. Good morning, everyone. All the respected dignitaries, panelists of the day, and my dear colleagues, on behalf of the National Coordination Center for PVPI, I welcome you all to the valedictory function of Second National Pharmacovigilance Week. Over the last 1 week, we have carried out many activities and we will systematically showing you all those activities. And first of all, we have the panel discussion today regarding the encouraging ADR reporting by the patients, followed by the announcement of the results of the posters, quiz competition, audiovisual animations, and lastly, vote of thanks. And we have also prepared a summarized film of the activities conducted at the National Coordination Center for PVPI. So with this, I request that all of you will be getting benefit from today's activities and from the valedictory function and will create the awareness about encouraging reporting by the patients. Thank you, everyone.
Thank you, sir, for the kind words. We will now start with our panel discussion of the day on the theme of encouraging ADR reporting by patients. To start with, I would like to invite the following dignitaries. We have with us to start with us, we have Professor Neelam.
We can't hear you. Sorry, we can't hear you. Am I audible?
So I request among the audience to please ask the questions, and our panelists are there to respond to the questions. Thereafter, we will also be listening to our panelists, what is their viewpoint for encouraging the reporting by the patients.
I'm sorry, I can't hear you very clearly. Am I audible? Can you hear me?
Yes, madam, you are clearly audible and visible.
Okay. Okay, very good. Thank you. I couldn't hear the last part of it, but I suppose I could start with the panel discussion.
Yes, madam. Yes, madam. You can start. You being the
Okay.
chairperson for this panel.
Okay,
I
thank you.
request you to kindly start, and madam, we will also be asking the questions, if any, from the audience side. And
Sure.
I request the panelists to respond to their questions, please.
Right. I'd just like to have a few slides. So can I be given the option to share the PPT?
Sure.
Yeah, just give me the option. I'm the presenter. So yeah. So um, can you see the slides?
It is just opening, madam.
Is everybody able to see the slide?
No, madam.
Not
No.
yet.
No,
No.
not yet.
Yeah, now it's visible.
Not yet.
It is
Okay.
visible now.
I'll try it once again.
No, madam, your slides were
Visible?
your slides were visible. Please replay.
Oh gosh. Okay, wait a minute now. I close the slide. Wait a minute. I'll get them on again. Gosh. Okay. Now I need to wait for a few minutes. I close the slide thinking that they're not visible. Just give me 2 minutes.
So shall I ask a question, sir?
No,
Sure.
just wait for a minute, because it's important for us to get some bit introductory thing, which may have been already, it's a bit of a recap, because I like to recap if I'm allowed. Okay. So I'll go share. I now have the apologies. Are you now able to see my slides?
No,
No.
ma'am.
No. Okay, let me just try it once again. Share. So something else has come into share. Let me close that.
Yes, ma'am. Now we can see.
Can you see the slide now?
Yes, ma'am.
Ma'am, again it just went.
Yeah.
Now we cannot see, ma'am.
Can you see the slide? Huh?
No, ma'am.
Now?
No.
No? Okay, let me just try it last once. Okay, and now I think we should be able to. Are you able to see now? I think so.
Yes, ma'am, we can see.
Yes, ma'am.
Yeah?
It is.
Oh, very good. Now
Oh.
I'll go to.
Yes, ma'am. We
full
can
s-
see now.
Yeah, I'll
Yes,
go to
ma'am.
full screen. Yeah? Excellent. So I just want to, bring us up. I'm sure this has been all already seen during the 1 week of this whole program, but I just want to have a bit of a recap that we have this World Patient Safety Day on the 17th of September, which is a global campaign to patient safety. And this is something which has been signed by 194 WHO member states at the 72nd World Health Assembly in 2019. Now, we know these facts that medication harm, so we're talking of patient safety, out of which medication harm is one of them, and it accounts for 50% of preventable harm and costs a lot of money. And it can be avoided if medication errors are prevented. Therefore, the WHO World Patient Safety Day of 2022, this year's, the theme is medication safety and the slogan is medication without harm. Now, WHO has put out guidance for various states of people. I put on the slide. WHO guidelines are for patient, families, and general public. So it says there's nothing new to us, but I'll anyway read it for our, recap sort of. When this is for the patient, when prescribe a medication, have all the information you need to take its safety. Keep list you take. Take your medication as recommended by your health worker. Use medication safety tools. Be aware of potential side effects of your medication. Store your medication as indicated. Check the expiry date. Raise concerns about your medication with your health worker. So this is what WHO's guidance has been. And now I will stop sharing the screen. Now with this background, we have this very important and interesting panel discussion on encouraging ADR reporting by patient. And I'd invite the panelists I'll call one by one and ask them as to what do they think about this topic of encouraging ADR reporting by patients. So I don't know if Urmila is here. Yeah, Urmila is here. Hello. Yes, I can see you. What do you think are the barriers for patient reporting ADRs to health workers or to the pharmacovigilance program, which is one of the initiatives of the PVPI?
What do sorry, ma'am, can you repeat the question?
Yeah, Urmila, if you can give your thoughts on this.
What are the barriers for reporting?
Yes.
Okay, I think.
Do you think patients report ADRs? That's one. And if they don't, what do you think is, or any thoughts on this particular topic? Welcome.
So I think there are a number of reasons why patients don't report. I would like to even focus on why doctors don't report, because doctors also are not reporting adequately, because first of all, they feel it's a big chore. I think they feel that they're the busy people that they are, they don't have the time to report. So they don't report it as a duty, as a part of a responsibility. Now, since we have been encouraging undergraduate students, I'm hoping that this will change as a policy from the beginning itself, that they get sensitized to this and therefore they will probably change. Why do patients not report? One of the reasons I can suspect is that I'm not sure that there's any literature on this. I don't think I have read anywhere any data that shows why they're not reporting. But I think patients are generally just scared of healthcare workers. And if they complain about them, then they worry that their treatment will suffer and therefore they should not report or complain. It's possible that is the reason.
Yeah, Thank you, Mila. You've been involved in pharmacovigilance for many years, we know. So what are your thoughts on suggestions? What can be done to improve patient or family members reporting workers or to PVPI? I can see that there are some hands. We will soon come to Dr. Gupta. But let's first hear from Mira.
Madam, you're asking me? Your voice is breaking. Are you asking
Oh,
me?
sorry, I think that,
She's a
yes, Mira.
Okay.
I hope
Yeah.
your voice is okay
Okay,
now.
fine. Yes. So, good morning, everybody, and it's really a pleasure to see Madam Shirsagar, Urmila Madam, and the whole team. I was involved in this consumer reporting form, which was prepared way back by PVPI in 2014. And we literally invited Dr. Kallai Selvan. I hope he's here. So we invited the consumer organization, and there were presentation from my side, from PVPI side, as well as from the consumer organization. And I think the whole concept which was taken up by consumer organization, that it is an activity against the doctors. So this concept that this is not an activity or take any action against the prescriber, and that is why this shows, even though the consumer organization representatives, they were quite literate, they were quite active, but the whole message which went was this is something which is to be done against the healthcare professional. So first and foremost thing is we need to spread the awareness as we are doing for other health care diseases, especially tuberculosis, HIV, oral contraceptive, family planning measures, that we need to educate, increase the awareness among the consumers, the patient, that this is an activity to increase the patient drug safety and nothing to do against, it is not an activity against the healthcare professional. Because the important barrier, if you consider the ground realities of our country, the literacy level is less as compared to the Western countries. There are a good number of countries across the world, especially USA, UK, certain European countries, even certain Southeast Asian countries, where the consumer organization, they have already implemented way back, and there is already literature that there are no discrepancy or deficiency found when the patients report adverse reactions. This may not be actually true for our country because the literacy level is too less. So here I would like to recommend one thing from PVPI, because they have the reports already, ICSR, or the even reports, adverse reaction reports, which are submitted to directly to PVPI or any other ADR monitoring center. What is the quality of report? Simply reporting without any critical information will be of no use. So the first and foremost thing is we need to analyze our own report at PVPI, that what are the number of reports by the consumers, direct reporting, what is the quality of reports, and what are the deficiencies, and then taking various measures to increase the awareness, to spread the awareness as we are doing it for other diseases.
Yeah, thank you, Mira. I think that's very true that we need to see as to give the right message to the consumer, so that for one, they should be made aware of the adverse reaction and how to essentially prevent them. And then if that happens, then to report, because they should be aware that by reporting, they are helping themselves and other patients. I think that's very important. I saw that Urmila is also raised hand, but Urmila, I'll first go to Dr. Gupta, who has had his hand raised for some time, and then I'll come back to you, Urmila. Yeah, Dr. Gupta,
Yes.
please
Good
go
morning,
ahead.
everybody. Good morning, everybody. It is a great
Can you
occasion.
speak a bit loudly, sir?
Yes. It is good morning to everybody. It is a great function that we are we are doing an awareness program, pharmacovigilance awareness program. You see, in this context, I want to say that we have to convey this message to our medical fraternity totally, because we have seen our research, our pharmacovigilance associate, whenever they are visiting the AMC center, they are getting very much difficulty in collecting the data.
We can't hear you clearly, Dr. Gupta.
Your
Hello?
voice
I
is
request
breaking.
everybody else to keep the video. Yeah. So that the
Hello?
bandwidth improves.
Yes,
Just
now it is
please
clear.
yes, please
Yes,
the except
yes,
Dr.
good morning.
Gupta. Even I'm
Yes, yes, now it is clear.
everybody please keep your video off so that you can hear Dr. Gupta. Please everybody switch off your video. Okay.
Now it is clear.
Madam and Madam, I don't know. Please switch off your video. Don't switch on the video. So we can hear Dr. Gupta. Yeah, please go ahead, Dr. Gupta.
Yes, good morning, everybody. We are organizing this awareness week. My question is that we are getting difficulty. Our research associate, pharmacovigilance associate, whenever they are visiting the AMC center, they are getting the difficulty in collecting the data, because doctors, physicians are always hesitating to give the report that such adverse reaction has been developed, because they are getting fear. Actually, doctors are getting fear that if they inform, then what will happen? It will go to the message to the patient, then he will lose confidence upon doctor. That's why doctors are hesitating. So we have to request, since this is a awareness week, we should convey this message to our medical fraternity that this awareness is required and you have to give the report of adverse reaction for the betterment of patient. We have to take suitable actions. That this is my message. Okay.
Yes, thank you, Dr. Gupta. Dr. Gupta's question was that.
One minute, sir. In the India year 1983, one pharmacologist, Dr. Vishnu Prasad Mukherjee of Calcutta, PG Medical College, he was professor there in Calcutta. So he has started, he was the secretary of Indian Pharmacological Society. And that time I was secretary in Indian Pharmaceutical Society. So that in 1983, he told us to arrange this joint program for collecting the data on adverse drug reaction. So then we have utilized our pharmacy students to visit several doctors. He has given them Profarma that we are giving now PVPI. And that time we have tried, but after 2 months, our program became failed. Then we told Dr. Mukherjee, please inquire what is the reason. Then he visited all the doctors that time in 1983. They told your program is good, collection of data is good, but we are confidently we are saying that we are unable to give the data, because when we are asking from the patient, then if there is a reaction, and then we are losing the faith on patient. Patient is thinking that Dr. Sahib has given me wrong medicine. That's why I've been suffering from the adverse drug reaction. That's why that time our collection of data on adverse drug reaction was totally flop. Now our PVPI center is working very well, and now we have started awareness week from the last 2 years. So I want we should make so much arrangement so that tactfully all physicians will be agreed to give the data. This is my suggestion. Thank you, madam.
Thank you, Dr. Gupta. I'll go back to Dr. Urmila. Urmila, you wanted to give, Dr. Gupta, you can lower your hand, which is raised. Urmila, you had some points to mention. Yeah, please go ahead.
Just wanted to say one thing. There's something that we need to work on, all of us collectively, is to change the perception that an ADR is a negligence. And that an ADR occurs as part of the pharmacology of the drug. We need to change this perception that if a patient develops an adverse drug reaction, it is because the doctor has either prescribed the wrong drug or has prescribed a wrong dose or anyway, it's the doctor's fault that if the patient has developed an adverse reaction. It's actually not the doctor's fault, it's the drug's fault, if anything. And we need to change.
You're absolutely right. Yeah. Sorry, go ahead, Urmila.
As well as amongst medical experts, that this is not so, because medication errors, we are so far behind in reporting. We're not even talking about medication. You talked about medication safety, and I think reporting of medication errors is one thing very high on the list in that. We don't do that at all. But at least first reactions which occur when you give the right drug in the right dose should be reported, because we can find out so many things. So this change in perception, I think, will help us at some point.
Exactly. Absolutely right. So really we can say that any ADR is on account of the drug, the dose, and also the patient factors itself. And therefore the patient need to be able to really, as Meera said, to be uh, made aware of all these factors. Meera, I'll just go to the next one on the panel and then come back to you.
Sure.
So Zubair Ashai, GMC Srinagar, are you there, Zubair? I don't know.
Good morning, ma'am.
Good morning, Zubair. I don't know where is Zubair. I can't see him.
I am Dr. Vikas Mehdi.
Yeah. I don't know Zubair. Has Zubair joined? Not sure.
Zubair, I think
Madam, Jubair is not there, madam. Dr. Jubair is not
Okay.
there.
Then I will just for a second, because if you just hold, we'll ask Meera to give her point, and then Zubair, Bikash, I'll come back to you.
Yeah, yes,
Meera,
ma'am.
you
Actually,
want to
I came
say
for a
some point?
physical meeting.
Yeah,
So,
Bikash, just hold on. We'll just ask Meera to give her point, and I'll come back to you, Bikash. Yeah, Meera,
okay,
please go ahead with your point.
Yeah, I think there are various methods to increase the awareness. I think we will go later on in detail. But if you look at from other perspective, there are certain drugs, even with the normal dose. I totally agree with Thatte madam that normal therapeutic dose given to the patient, still it can cause adverse reaction. For example, anti-tubercular drugs. So if you look from the other perspective, there is also a very thin line, because this will be a part of awareness, that we also should consider about the compliance, adherence to the treatment. Patients' literacy level is so low, especially in view of other Western countries. If you consider the remote areas, those who are suffering from certain disease where the drug treatment is to be regularly, lifelong, even HIV or tuberculosis. And if the awareness is spread and we inform them that this can happen with the drug, please report it. So that is fine as far as the PVPI is concerned. But can this also cause a scare, which can also affect the compliance? We need to look into that aspect also.
Yes.
So if the adherence is affected by spreading the awareness, what will be the consequences for certain disease where the drug treatment is lifelong, where the drug treatment is associated with the reactions which can happen even with the normal therapeutic doses? So this, I'm just looking at the extreme perspective, extreme aspect of the drug treatment. So this may also happen, the compliance is affected, and that can be affected very badly.
Yes, so we have had these 2-3 points till now in the discussion, raising awareness, but whether that itself will have a negative impact.
True.
And Urmila's point that this point of considering it as an error, awareness for that is also needed. I'll now ask Dr. Bikash Mehdi to give his perspective of the whole thing, Bikash.
ma'am, actually, if I look back in 2010, I remember 2009 we had a meeting. So that time we discussed that we only allow doctor, dentists, and pharmacists or nurses to be reported. Then our thing changes, because if you look at MedWords or any of the yellow card or blue card system, everybody can report, anybody, caregiver, patient. So in 2014, Dr. Pai and myself was there in Puspagiri in Kerala. So there we decided that we'll convert this, ADA form into the local language. So that's how it was converted to local language, because we encourage the patient to report and it has to be in the local language. So that's how we said that we have a toll-free number, anybody can report, caregiver can report. But we put a mechanism that anybody can report, because we talk about, like Dr. Miradesa is rightly pointed out, that quality is very important. You might get a report, but if we cannot use this data, if the quality is not there, then it will not be useful for future. So that is why you say that, we'll put a mechanism that can we verify from the neighboring area monitoring center. Any report comes, if from Chandigarh comes, definitely I'm going to take that, verify what exactly happened. So that is what we did. But one thing is that we are still struggling with underreporting. That is a, global phenomenon. It's not in India. But if we encourage the patient to be reported, because we have to also make sure that we have to give little time when the doctor prescribe a medicine. So at least tell them problem, please go to us. So I think I feel that there's a long way to go. But yesterday we have an experience, like we had conducted a awareness program among those who are retired people. Okay, so they have a lot of polypharmacy. So we discuss about medication management with them, a CSR lab. So similarly, we call the geriatric. Today also I came. Actually, yesterday we did around 6 sessions like this. Today also I came to one of the place. So I think we can address them, because they have a lot of queries, because basically they need to know that, there is a system they can report. And exactly, we from our side, we have to be very careful that whatever report it comes, it's a quality report. So then it can be utilized for, this is very important. Otherwise, you might get a report, but uska aage bhi nahi hai, piche bhi nahi hai. So uska matlab use nahi hoga. That is my point.
It doesn't
Thank you very
have,
much.
yes. Thank you, because that is bringing out the point that whatever report that we get needs to be of good quality. I saw that Kiti has raised
Let
her
me
hand.
Have done last 1 week almost 55 program like this.
Yeah, thank you. Yeah, Trupti, please go ahead. Good to see you.
Yes, namaste, madam. Namaste, madam. Actually, in our part, I mean, Eastern Indian region, we have a very peculiar problem. Like, it is a big problem regarding reporting culture. Like every government system and private, because our state government has promised almost any drug free of cost. And also this same thing happens for the material vigilance program. So here, suppose you want to report, even the doctors, paramedical staffs, and we are actually can diagnose the problem is there, but because the media will attack the person, and because it is if it is of poor any adverse reaction is associated with poor quality. So many doctors and paramedical staffs actually are, even though they are knowing that, but are reluctant to report it, because this is a way to attack the government regarding the quality of the drugs. If they are happening,
Yeah.
that is a very peculiar
Yes.
problem we are facing here.
So that is, I think, in cases that the doctors and the workers are not that motivated to report. But we have question also from another person, but I don't have anything here. Can you give your name? Who has raised the hand now?
Hello.
Can't see you, so not sure.
Madam,
who
I'm
it is.
audible. I'm audible.
Outer Gupta.
हाँ
Ram
मेरी आवाज
Outer
आ रही
Gupta.
मेरी आवाज
We
आ रही
can hear you. Yes, yes, we can hear you, Ram
myself
Gupta.
Amri Gupta, Secretary Indian Pharmaceutical Association UP State Branch from Lucknow.
You are from Lucknow, and you are secretary of
Indian Pharmaceutical Association IPA.
IPA. Okay, please go
and,
ahead with your
and
comment.
was associated with the Subject Review Committee of NFI 2021.
Okay.
With IP Commission. And I served the UP State Government as a hospital pharmacist for 39 years. And with that experience, and I'm worked from PSC to the super specialty hospital. So I want to share something, my views. Number one, I want to congratulate the PVPI and the IP Commission, Secretary, Director, Dr. Jayaprakash sir, and Government of India to start the National Pharmacovigilance Week. And it's a coincidence that it has been started from the day that is known as the Patient Safety Day, World Patient Safety Day. So, as concerned with this Pharmacovigilance program of India, my experiences are that the doctors are hesitating to report ADRs. Number one, they think that it will be additional work and we will be answerable because it will be in the record and we may be punished. So this perception should be changed, number one. And the PPI and Government of India and the authorities should try to work in this direction. Second thing is that the separate program. Madam, I'm audible? Hello?
Yeah, we can hear you. Yes,
Yes.
Dr. Gupta, we can hear you.
My suggestion is that separate program for the private sector hospitals like your Apollo, like your specialty hospitals, Max, Vedanta, like that. Separate program for government hospitals means PHC, CSC, and district hospital level, associated with the rural patients, illiterate patients, which the previous speaker has pointed out, should be framed, and separate program for the private pharmacies. They are legs and legs in our India, and spread very fast like mushroom in last 2 or 3 years due to increase in the pharmacy intake of the students and the training capacity increase. So the separate program should be for the private hospitals and the pharmacies. And this is a great work. This is a big work. Not it is a single done by the IP Commission. So all these stakeholders, either they are the medical professionals, or they are the pharmacy professionals, or we the organizations or the associations, should come forward and approach the state governments to frame new MCs, to launch new MCs, quality of reporting, and to give a assurance to the doctors and paramedicals, as the previous speaker has told, that you will not be punished. And in our seminars,
Dr. Gupta, we can't hear you anymore.
Pardon?
Okay, I think we got your point. Maybe we have one more person in the audience who we can request to go ahead with his questions. And
Madam, can I say something?
Yeah,
Dr. Vain from
as much as possible. If you are brief, that would be good, because then more people will get an opportunity to speak. If it is okay, yeah, okay. Thank you, Dr.
Actually, I'm
Thank
Dr.
you.
Venu.
That was a very good outline and importance of from your perspective of IPS. First request, but I can't see your name, so I don't know who it is. Can we have name? Who has
I'm Dr.
raised
Venu.
hand? Please
Hello.
go
Dr. Venu
ahead
Talla.
with your question and comment.
Hello.
Sayyadani is Dr. Sayyadani. Please go ahead
Yes.
with questions and answers.
Hello. Yes, ma'am. Good morning.
You're not audible. Dr. Gupta and Dr. Trupti and others, can you switch off video and audio so we can hear Dr. Sayyadani's? Dr. Gupta and
Hello.
others can switch off. Yeah. Dr. Anis, please go ahead.
Yes, good morning to everyone. One thing I would like to point out is that in India, most of the common people, they do not like to fill forms. So filling a form is very difficult for common public. They hesitate to do it. So instead of asking them or promoting to fill form, I think it is better if we include a toll-free number. We are already having a toll-free number. We should include this on prescription pads and also on the medicine. On the packet of the medicine, we should include that toll-free number, and we should write that if you are having any kind of adverse drug reaction, you should report on this number. And I think that this by doing this, it would encourage reporting by the patients, and also this would lead to as ma'am pointed out, that patients are illiterate, so they may not report accurate data. So the other person which would be sitting on the other side of the toll-free number, that that person would elicit the correct data from the patient, and that problem would also be solved. So this is what
Yes,
I want
Dr.
to.
Anis, Yes, those are very good suggestions. I'd request our next panelist, Dr. Jayaprakash, to give his comment, and then I'll get back to Meera and Urmila. So, Dr. Jayaprakash, would you like to give some comments on all these points which have been raised till now? About creating awareness is one point, and awareness, particularly that every ADR is not because of errors, it's on account of patient factor, drug factor, and the dose factor. And also Dr. Saidanis' suggestion about the toll-free number, people don't want to fill up forms. So Jayaprakash ji, if you can, Dr. Jayaprakash, if you would like to give some idea, suggestion and comment on these points and any more. And then I'll get back to Urmila and Trupti.
Thank you, madam, for
Urmila and Meera, sorry.
Thank you, madam, for giving this opportunity. Let me share the PVPI experience. We had started the toll-free number way back in 2013. That moment, the number of reporting by the patients or consumers was quite low. And this time we see that it has exceeded on annual basis 200 reports from patients alone. So we see that it is gradually increasing and it is taking the momentum. And from this for National Pharmacovigilance Week onwards, we have also taken the initiative to organize the walkathon, and we have also come out with a pamphlet with the pamphlets to create the awareness among the consumers, and this pamphlet covers the Pharmacovigilance Program of India, Materiovigilance Program of India, as well as the Hemovigilance Program of India, who can report, where it can be reported, and how it can be reported. Apart from this, we also thought worth that a calendar should also be devised. So a calendar for 2013 we have prepared and disseminated among the public, and it gives the toll-free helpline number of the PVPI as well as the ADR mobile application to be used for reporting by the consumers. So we have also seen that since last year, the number of the awareness programs, training programs, and sensitization programs, not only for the healthcare professionals, but also for the consumers and nurses, have been increased. And I think in the time to come, this will take the momentum. And though everybody in India at this moment is not illiterate, and there is a lot of awareness, but still we have to go a long way. And in the time to come, this awareness will be increased at par with the other countries like European countries. Many countries like New Zealand, Italy, United States of America, and other European Union countries, they have the system for reporting at the level of the consumers, and the counseling of the patients is also organized there. I think in India also the fear about reporting is still there in minds of many personals, even the healthcare professionals. But here at IPC, we maintain the data of the patient in a confidential manner, and even it is not shared if asked by anyone through the Right to Information Act 2005. So this way, I think there is need to create awareness more, and the consumer associations, their involvement is also necessary. So last time, the non-governmental organization like Health Cofia Foundation, they spread the awareness among the consumers. They went to many chemist shop across many states in the country, and other consumer forums are also should take up this as an agenda for creating the awareness in the overall interest of the patient safety. So these are my views about the consumer reporting, and consumer toll-free helpline number remains open for all the 5 days from Monday to Friday from 9 o'clock in the morning till 5:30 in the evening, and anyone can report. And looking at the magnitude of the reporting, then we will also think of how to extend this facility for more duration or to make some shift arrangement for increasing the awareness and collecting the data from the patients. Thank you. Thank you everyone for the attentive
Thank you.
listening.
Thank you, Jayaprakash. Thank you very much. I could get back to Meera. She had raised her hand. And I don't know who is IPC at 1, 2, 3, 4, whatever.
I am Dr. Venu, madam. Actually, I am unable to rename.
Okay,
Actually,
so
I am from Hyderabad, working as a professor in Sarojini Naidu Vanitha Pharmacy College, and we are dealing with pharmacy students. Actually, I have one concern, madam. So most of the people who are attending these hospitals and all, they are all from rural India, and we are giving a lot of awareness in urban areas. And but at the end, see, as you pointed out, most of the patients who are illiterate are rural India. And what is IPC, Indian Pharmacopoeia Commission, action plan to address the rural India, particularly about pharmacovigilance?
yeah, thank you. Thank you for that comment. We'll have Meera's comment and then Urmila's, and then we'll see if there are more comments from others. Yeah, Meera, please go ahead.
Hello.
Yeah, Meera, we can hear you.
Yeah, thank you, madam, for the opportunity. My response is in connection to Dr. Anis. Especially the concern is, obviously, we all agree that nobody likes to fill up the form and nobody has the time nowadays. Now, in this context, I was just thinking about two possibility. One is already in line, which is coming by WHO. Let me share with you the first one. Yesterday, we had a webinar, and there was representation from WHO, and they are coming up with the mobile app. It will be available for reporting, and the healthcare professional as well as the consumers can report. So that will be, I think, eventually over a period of time, that will be made available. The point which is coming to my mind in context to the healthcare professional, the consumers, everybody is very busy. On the other hand, if you look at the current scenario, almost everybody, almost 90% of the population in India, they have smartphones now. So downloading the app, or the other way, can we have, is there a possibility of having a QR code? Hello, please mute yourself.
Okay.
Can we have a QR code, so that QR code is displayed in all the healthcare facilities, the pharmacies, where the patients are moving and the medical persons, the healthcare professionals are available. So by just exposing to the QR code that entry, that this reaction has happened, so that that signal goes to the IPC or the nearby ADR monitoring center, so they can get in touch with the consumer, the patient, or a healthcare professional and get all the details. So this is just coming to my mind. So maybe I'm just floating the idea, we can have the views. Is there a possibility of having a QR code for the ADR reporting form, which can be for a quick access, as we do it for paying online transaction? So similarly, is it possible to have it for the ADR reporting form, either by consumer or by the healthcare professional. So to have a quick access, so that the nearby ADR monitoring center, the pharmacovigilance associate, can get in touch with the person and get the details. So that filling up the form and that whole
It is excellent idea, madam. But if it is in local regional language, I think the number of enrollments may increase because
at least yes, at least this can be conveyed to the nearest pharmacovigilance associate and ADR monitoring center. They can get in touch with the person, the patient, or the healthcare professional, so that the quality of data, the number of reports can eventually, although this will take time, but this is just an idea.
There is a hand up. Yeah, thank you, Mira. There is a hand up from the table there. I can't make out from where this is, whether it is IPC table or who wishes to raise the question, and then we'll get back to Urmila. Can you name yourself who wants to raise this question? I can see that there is a table and many people sitting around the table, but I can't make out who they are. Pharmacology at Raipur. Pharmacology at AIIMS Raipur. Good. Who you have your hand up? So any question that you would like to raise?
Madam, greetings to all of you.
We can't hear you yet. In Raipur, I don't know who is there. Please go ahead and put your question or comment.
Yeah, madam.
We are not able to hear you though.
Hello.
Somebody is questioning, otherwise we'll go back to Urmila after we can't hear you. Maybe get the mic close to the person who is going to speak.
Hello. Are you audible?
Yeah, go ahead. Yeah, we can hear you. But
सुन
need
रहे हैं
to
आप?
speak loudly.
Hello.
Yes, please go ahead.
Madam, it is a very good program to run by our government. I am very happy to that our government think about ADR of drug for patient welfare. I am very interested in this program, madam.
Okay.
Very good program.
Yeah,
For
Prakash,
patients.
you are congratulated by these attendees here. Any further points that you would like to mention?
Thank you, madam.
Thank you. Then I'll ask Urmila to give her comment then.
Hello,
Yeah.
ma'am. Am I
Yeah,
audible?
Urmila. Go ahead.
I actually wanted to put, I mean, maybe it's unfair, maybe it is silly, but I just wanted to put a note of caution in when we are opening up to the public to report. Because when we say public is reporting, one, there may likely not to be any quality. Even though you may have a system where somebody will go and check this report and everything. For that, again, the network will have to be much wider than it is right now. Second of all, I'm worried about not spurious, these naughty reports. Naughty as in people just reporting, making reports just to create trouble or just to make themselves heard when actually nothing has happened. You know that this can happen, everything. I mean, when we look at social media and the impact social media has on all our lives nowadays, I would like to put this thought or this caution that we must think through this whole thing. Although I have never said that patients should not report, but they should report, and it is they who are suffering. But they should report this to their doctor, who should in turn report.
So you have concern about direct consumer reporting to PVPI, and of course there are there are various aspects of it, and people have you're right that it could actually be nullified reporting rather than a bona fide reporting with any ultimate aim of many different ways that people can want to draw some mileage out of it, or mileage, money, publicity, whatever you say. So those kinds of things are all part of it. And yes, so that we need to have that assessment and filtering out of it. No doubt about that. Definitely. I still see the hand up at this round table. I don't know. Are there anybody else from the audience who would like
Yeah,
to
ma'am.
ask?
From AIMS Raipur, ma'am.
Yeah, please
Ma'am,
go ahead.
Yeah, ma'am. Dr. Nitin Gaikwad, ma'am, from AIMS Raipur.
Yeah, Nitin, go ahead.
Yeah,
See
ma'am.
you.
Yeah. Good afternoon, ma'am. Ma'am, just to add few points. Already, most of the points are being already discussed. The bottom line is the lack of awareness, ma'am, because the patient, they do not know whether it's a ADR, and they don't know about the ADR monitoring system. Such kind of system exists in the India. That is the main reason. And many times they consider those ADR as a part of the symptoms of the disease itself. So that's why the most of the time there is a lack of awareness, and that's why they do not report. The second point I just want to contemplate here, that the toll-free number is being widely published. Definitely, we also included in our AIMS Raipur on the prescription pad and IPD cards as well. Although there is again a wider publicity is required, ma'am. Maybe because mass media publicity is required, maybe in the form of a walkathon, or maybe advertisement on a boards, on a buses, or what. Because we have not gained such kind of momentum as that of the national program. The other programs, national programs of our India, they have got the momentum. So maybe in the DD nationals or radios or other channels where we can project such kind of awareness program, and we can display the toll-free number. The second point regarding as Meera madam has rightly mentioned about the reporting of the adverse drug reaction in the various programs, for example, National Tuberculosis Elimination Program. So we do have some connection at our own level, ma'am, but I think there require some structural changes, policy decision to include pharmacologists as a part of National Tuberculosis Elimination Program, because whenever they form a committee, there is a mention the clinical pharmacists. So if the pharmacologists are included in some national programs, say maybe related to the HIV or TB, then I think the reporting of the person, and the second, the last, I will just say the capacity building of the DOTS provider who are in the close vicinity of the patient. So if we have such kind of plans for capacity building, then I think we can report the more ADRs from the consumer for the different diseases for which the patients are taking the treatment. So these are my few submissions from my end, ma'am. Thank you so much.
Thank you. As you know, we had got an extensive program at PVPI on PVPI and public health programs, including tuberculosis, HIV, malaria, and leishmaniasis, and so on and so forth, HIV. And in fact, we had brought out, and this is there on the TV program's website, a document which is for ADR management and prevention. And there are separate documents for healthcare workers, medical professional, doctors, specialists, and also for patient themselves as to how to monitor, prevent these ADR, and also part of it is ADR reporting. There are also similar ones, but not sure whether they have pharmacologists on their various expert groups or not. But yes, we all will agree with you that we need to have a pharmacologist on those groups. There are for TB, as you know, and Jayaprakash will add to that, there have been lots of attempts to, TB have a program called Nikshay, and then we have the separate PVPI. So there have been lots of attempts to connect the two, because nobody wants people to enter things twice. So those are some of the activities which have been undertaken, but there are also some issues and problems which are challenges, which maybe at some stage Dr. Jayaprakash will add to that. And I see Dr. Mita Nandi's hand up. Yeah, Dr. Mita Nandi, please go ahead.
Hello, everybody, and good morning. I was just listening to all of you. Like, I have only 2 points to make. First is definitely we need to increase the
Switch on
awareness.
your video so we can see you. And
Okay.
where are you from? And which?
Okay.
Where are you from?
Am I visible?
Yes.
Yeah, by now. Yeah, and where are you from, Mita? We can see you now.
I am from. I'm retired now, but definitely working with IPC past 7 years on pharmacovigilance and CDSCO and AEFI. So I'm into different bodies. We're
Very
working
good.
as a consultant. Yeah. So
Excellent.
what my observation is, like while I look into the ICSRs, like what we can blame that the consumers are not reporting properly. There's that we do say, and there are unawareness and training is required. But my one submission is, why then people who are trained, they don't send us a complete information as per the format at least. We expect that much because all from government colleges and hospitals where everybody is trained, still most of the time what we find that they are not complete and contradictory information comes in. It becomes very difficult on our part to actually come to a conclusion. And best would be to give a evidence based information to us on that format so that we come at a conclusion. Otherwise every time the cases just get postponed. Okay, observe, go for a few more months, observe, but then we never come to a conclusion. So my request here is, so many stalwarts are sitting here, so please, when the formats come to IPC, please see that you give little time and give us some quality information so that we can come at a conclusion. That's it.
Yeah, thank you. Thank you very much, Mita. There are some comments which are pertaining to operational activities of PVPI, which I'm sure Dr. Jayaprakash may be reading them and he will take due action and
Yeah.
note on that. I'm sure I can see from Urmi Chaudhary, technical associate, difficult to get reports in spite of it. That I can see that. And then also from Pinaki Chakravarti,
Yeah.
Sudha Sharma, everybody is different. Yes, we agree with you, Sudha. And improved reporting by patient, which is the theme, innovation from Trupti, innovative IC. Yes, so there are lots of comments in the chat. In the interest of time, we will not take these operational viewpoints here. I just want to go back to Vikas if he has any further comments, and then to Jayaprakash again if he would like to have comments on some of the points which have been raised here about the negative part of it, malified reporting, which Mila raised, and then the possibility of having a QR code, which Mira mentioned, and what Mita mentioned about the quality of reporting from the existing medical professionals. So, Dr. Jayaprakash, would you like to give, and then I'll come back to Mira. Would you like to give your comments and thoughts on this?
Thank you, madam. I would like to comment on the coordination from the tuberculosis program. Madam,
yeah,
we recently conducted a meeting with Dr. Rajendra P. Joshi, Deputy Director General of Central TB Division and National Tuberculosis Elimination Program at New Delhi. And he was very optimistic to have the coordination with the PVPI, though they have Niksha software that is operational. And thereafter, a meeting has also taken place with our director. And in the time to come, we are thinking how both these softwares can be integrated. And the Ministry of Health and Family Welfare is also very keen to integrate this with the national health programs, the Pharmacovigilance Program of India. And we have noted the comments received from all the panelists and the audience, and we will try how these comments can be implemented at the field level for making the PVPI more successful and effective in the interest of the patient safety. Thank you, madam.
Thank you. Mita mentioned that she's on the panel of AEFI and we have many others. And Dr. Jayaprakash will remember that we had a lot of sessions on AEFI, particularly at the start of the COVID pandemic. And when we had the COVID related vaccine rolled out. some of the things that were noted, and I'm sure everybody would remember that some adverse reaction, and we remember that there was somebody from, I think, from Chennai or from South, and he reported loss of memory and so on, and it came directly into the news media. I'm not sure whether this was ever reported to the PVPI and the AEFI itself. The problem that happens with consumer reporting is also, as mentioned by Urmila also, that we have to sift between malafide and bona fide reporting. But also what happens is that the media catch this kind of ADRs very quickly. And for Mita would bear me out that for the AFI team to actually come to a conclusion, even if you look at their own flow chart, it takes a good 100 days, or maybe they can shorten it, but it still takes many days for that report to come out. And the media never then report that analysis of an ADR which they have previously reported. And Mira also already mentioned that any ADR reporting may affect compliance. So I would want to ask those who are in the AFI committee and also Jayaprakash as to how can this kind of a situation of reporting by the media. You think that PVPI should have some programs with the media so that people become more aware of it and the time taken and so on. I'm sure it's not possible to shorten too much the time for analysis, although it can be shortened, but there'll be still, it won't be, when a patient reports to the media, within 24 hours, it goes viral and is amplified. It can't, the actual reporting from an AFI committee can't come that quickly. But then that report doesn't go viral or is not amplified. So which is, some of the concerns we need to see. So I'd just like to, ask Jayaprakash and also Mira some thoughts on this, and if Urmila and Vikas also have some thoughts here.
Madam, we have noted your point, and in this regard, I want to tell everyone that we had trained our pharmacovigilance associates for 2 days on 7th and 13th of January 2020. So that and we had also circulated the AEFI case reporting form to adverse drug reaction monitoring centers across the country, and the reports received from our AMCs on AEFI, they are being sent to the AEFI secretariat, and the potential signals or the drug safety alert related to the AEFI, they are also being sent to the AEFI secretariat for taking the action at their end as regards the safety matters of vaccines are concerned. And regarding the spreading awareness through the media, we have noted this point and will try to take the action in this matter as well. Thank you very much.
Thank you, Jayaprakash. And Mira, yes, please go ahead.
Yeah, I have 2 points. The first and foremost thing is the Central TB Division under Government of India. They do invite clinical pharmacologist on the panel, especially when there is an adverse reaction, especially for the new drugs. And lately there were 2 drugs which are introduced, that is bedaquiline and delaminid for drug-resistant tuberculosis. I think myself and Dr. Shirsagar madam, we were on the panel even before taking the decision to remove the injectables from the anti-tubercular regime. I think even a good number of pharmacologists were consulted. Yes, I do agree that we do not attend each and every meeting, but especially for the causality assessment of adverse drug reactions reported with the anti-tubercular drugs, with the newer drugs, the pharmacologists were there and were involved in the decision-making process. That is one thing. Second is, as far as the awareness, consumer awareness is concerned, I was just thinking, madam, can we involve the pharmaceutical industry, the manufacturers, as a corporate social responsibility to undertake the consumer awareness? So if we can, and that can also include the social media awareness. They are supposed to do the various community activities. So the pharma industry who are producing, manufacturing, marketing the drugs, let this responsibility be also be given to them to spread the awareness, and the responsibility is also of PVPY. So this will come from both the sides, involving the primary healthcare, secondary and tertiary healthcare system, and the general population. So whether this will make a difference when it is coming from all the angles, all the sides.
Thank you, Mira. Thank you for those suggestions. I'm sure that's a lot of food for thought there. And I think we are coming to the close of this panel discussion. I can see that we have had some very good participation from the audience also. I see that there are good many people also participating. It's an important topic of encouraging ADR reporting by patients. We have had listened to the pros and cons and the current situation, and what can be done further to encourage, what could be the downside of it. I think we have given a lot of suggestion to Dr. Jayaprakash, and I'm sure this is a dialogue which will continue through our various uh, training panels that we have, or training discussion that we have. And I think with these few words, I don't know, I hand over to IPC for their final closure of this panel discussion. And thank you, IPC, Dr. Jayaprakash in particular, who has made sure that all of us are well communicated about the program. And thank you for inviting us here and sharing our thoughts here. And thanks for all the audience as well. Handing over to IPC.
Thank you, madam.
Thank you all very much.
Ma'am, I would like to request all the panelists and participants to please switch on their video for photo session, and then please stay with us. Like, we have distribution of prizes also. So I request all the participants to please stay with us for the same. Please switch on your video. Once again, I request all the participants to please switch on their video for the photo session. Thank you so much. Now, I would like to thank Professor Nirlima Shirsagar, Professor Urmila Thate, Professor Mira Desai, Professor Bikas Medi, and Dr. Jay Prakash for giving their precious time and being here with us in panel discussion and gracing our valedictory ceremony of Second National Pharmacovigilance Week 2022. Now, we will be moving with our next session, that is announcement of results. I can see all my colleagues are waiting for this moment. So we have with us Firstly, I would like to announce the results for e-poster competition. First prize for e-poster competition goes to Ms. Sri Lakshmi Nair, second year MBBS student, Turner Medical College, Navi Mumbai. Then, second prize for e-poster competition goes to Ms. Ayushi Yadav, Junior Pharmacovigilance Associate, NCC PVPI, IPC, Ghaziabad. May I request Ms. Ayushi Yadav to please come on the stage to have the award. May I request Dr. Jay Prakash to please give away the award. Now, the third prize for e-poster competition goes to Now, the third prize for e-poster competition goes to Dr. Sayyid Sarjal Anis and his team. The contributors for the same were Dr. Sayyid Sarjal Anis, Dr. Prashant Maurya, Dr. Shalini, Dr. Prachi Chauhan, Dr. Siddhant Loya, Department of Pharmacology, Dr. Ram Manohar Loya Institute of Medical Sciences, Lucknow. A heartiest congratulations, sir. Now, the consolation prize for e-poster competition goes to Mr. Sohan Pekre, MBBS second year student, All India Institute of Medical Sciences, Raipur, Chhattisgarh. Now, we will be moving on to animation video competition results. First prize for animation video competition goes to Dr. Ghazal, Junior Pharmacovigilance Associate in Bhatinda. Then, second prize for animation video competition goes to Dr. Shiva Murthy N, Coordinator, ADR Monitoring Center, CDSI MER, Karnataka. Third prize for animation video competition goes to Dr. Meena Kumari K and her team. She is coordinator of Kasturba Medical College, Manipal, and the team members are Dr. Arpita Roy, postgraduate student, Dr. Anisha B, postgraduate student, Dr. Shivani Singh, postgraduate student, and Dr. Aditya Vinayak, tutor. Now, the consolation prize for animation video competition goes to Dr. Nitin Revaram Gaikwad, coordinator AIMS Raipur and his team. Dr. Puga Zentan, deputy coordinator AIMS Raipur, and the team members are Dr. Nikunj Rajkumar Agrawal, Mrs. V. Sravanswati, Dr. Mahesh Kumar B, Dr. Jajini R, Dr. Abraham Joseph, Dr. Praji Arunima, Dr. Krishna Priya, and lastly Dr. Kiran Rangshai. Now, lastly, I would like to announce the results of Pharmacovigilance quiz competition. First prize goes to Mr. Hamad Ali, Pharmacovigilance Associate, Dr. Richa Chaudhary, Junior Pharmacovigilance Associate, Dr. Vijit Agrawal, Senior Pharmacovigilance Associate, Dr. Mahima Maheshwari, Junior Pharmacovigilance Associate, and Dr. Abhi S, Junior Pharmacovigilance Associate. They are present with us. So, may I request Dr. Jay Prakash to please grace with the award. Dr. Richa Chaudhary, Junior Pharmacovigilance Associate, NCC PVPI. Dr. Vijit Agrawal, Senior Pharmacovigilance Associate, NCC PVPI. Dr. Mahima Maheshwari, Junior Pharmacovigilance Associate, NCC PVPI. Now, the second prize for Pharmacovigilance quiz competition, we have with us Nikita Mishra, Pharmacovigilance Associate. Please come on the stage. May I request Dr. Jay Prakash to give away the award? Next, Dr. Sneh Pal, Junior Pharmacovigilance Associate, NCC PVPI.
Congratulations.
Next we have Mr. Akash Deep Rawat, Junior Pharmacovigilance Associate, NCC PVPI. Next we have with us Neha Naseem, Junior Pharmacovigilance Associate, NCC PVPI.
Congratulations.
Next we have Dr. Shatrunjay Shukla, Scientific Assistant, National Pharmacovigilance Program. On behalf of Dr. Shatrunjay Shukla, Mr. Rohit is taking the award.
Congratulations.
Now, the third prize for Pharmacovigilance quiz competition goes to Ayushi Yadav, Junior Pharmacovigilance Associate, NCC PVPI.
Congratulations again.
Next, Tripti Purohit, Junior Pharmacovigilance Associate, NCC PVPI. Next, Ms. Deepti Sardeva, Junior Pharmacovigilance Associate, NCC PVPI.
Congratulations.
Next, Dr. Priyanka Kaushik, Junior Pharmacovigilance Associate, NCC PVPI. Then we have the awards for skit or Nukkad Natak for creating awareness among general public about reporting ADRs. So I would like to announce the results for this. Team A, Sahil Punia. They are the MBBS students of Santosh Medical College, Ghaziabad. Sahil Punia. Team A, Sahil Punia, Sanjeevni, Prakriti Pandey, Neelmani, Sajal Rana, Rishika Gautam, Atharv Agrawal, Hitesh Kumar, Ayush Kaushik. Sahil Punia. Sahil Punia. Sanjeevni. Prakriti Pandey. Neelmani. Sajal Rana. Rishika Gautam. Atharv Agrawal. Atharv Agrawal, Hitesh Kumar, and Ayush Kaushik. Then Team B. Team B, Gaurav Vats, Khushi Singh, Harsh Chaudhary, Kirti Kumari, Udbhav, and Ujjwal Gupta. Now, may I now request Dr. Jay Prakash, Senior Principal Scientific Officer and Officer in Charge, Pharmacovigilance Program of India, IPC, to give closing remarks and vote of thanks on 2nd National Pharmacovigilance Week 2022.
Thank you, Dipti. Now we have come close to the end of the 2nd National Pharmacovigilance Week. Over these 7 days time, many experts were available with us and all of them tried to share their experience with us. On day 1, inaugural ceremony was conducted at the Indian Pharmacopoeia Commission, Ghaziabad, and we had the privilege of having Dr. Rajiv Singh Raghuvanshi, Secretary cum Scientific Director, IPC. Then PVPI update was given by me. We also had Professor Y.K. Gupta, National Scientific Coordinator and Chairperson of Signal Review Panel of PVPI. On behalf of Central Drugs Standard Control Organization, we had Deputy Drugs Controller from North Zone, Madam Rubina Bose, and Dr. Montu M. Patel, President, Pharmacy Council of India, and on behalf of WHO Country Office from India, Dr. Madhur Gupta was present. On second day, we had conducted PVPI stakeholders meet on 19th of September 2022, and the experience about the pharmacovigilance activities at the AMC at Vaidehi Institute of Medical Sciences was shared by Professor Ananya Chakravarti. And to cover the consumer or NGO perspective, we had Ms. Arsia Bhandari with us, and industry perspective was covered by of the NCC PVPI staff and the staff of IPC, the students of RKGIT Ghaziabad, and MBBS students of Santosh Medical College at Ghaziabad, and we saw a grand success that at many places the team of these young doctors sensitize the consumers about reporting of the adverse events in two hospitals, one the combined hospital in Ghaziabad and also near God City in Ghaziabad. So they performed Nukkad Natak. And not only this, during this whole sensitization program of the National Pharmacovigilance Week, we saw a wave of pharmacovigilance awareness activities throughout the country, and from regional training centers, from our AMCs, lot of support was there, and from each of these sectors, there was representation of the students, faculty members, nurses, and health professionals for creating the awareness about the reporting. On fourth day, field activities were conducted by the National Coordination Center for PVPI officials in different hospitals, and we received an overwhelming support from Chief Medical Officer from Ghaziabad district. On day 5, a quiz competition was conducted by the NCC PVPI, and we have just given the awards and certificates of appreciation to the concerned participants. And today is the last day of the second National Pharmacovigilance Week. Our panelists contributed a lot, and I think this will go a long way in establishing the culture of reporting by the consumers, and it will also create a wave in the minds of the officials attending this program how important the safety aspect of medicines and medical devices is. on the last day, just before the last day, an international event on the utilization of the VG flow and signal detection was also conducted by the MVPI team. And we had the representation from 7 countries, and this was a successful event with the help with the help of the expert speakers from Uppsala Monitoring Center at Sweden and the WHO headquarters at Switzerland. Last but not the least, we have prepared a short film of the glimpse of the second National Pharmacovigilance Week, and I request my team to please focus this film in the interest of all the audience, please. And then I will propose the vote of thanks. Now it is the time to propose the vote of thanks. First and foremost, I would like to propose my appreciation and indebtedness to the Ministry of Health and Family Welfare, Government of India, for according approval for conducting the National Pharmacovigilance Week. And today we see the momentum across the country, and the credit goes to Sri Rajesh Bhushan, Secretary, Ministry of Health and Family Welfare, Government of India. On behalf of the Ministry of Health and Family Welfare, we saw the presence of Deputy Secretary Dr. Kiran Kumar Karlapu from the ministry, and we were all inspired by his words, and we are very thankful to the Deputy Secretary from the Ministry of Health and Family Welfare, Government of India, for sparing his valuable time with us during the inauguration of second National Pharmacovigilance Week. Our Secretary cum Scientific Director, Dr. Rajiv Singh Raghuvanshi, provided the financial and administrative support to the proposal for conducting the National Pharmacovigilance Week at IPC, and providing the support also to the adverse drug reaction monitoring centers across the country. Though he is not available with us today, but he was present during the inaugural session of the second National Pharmacovigilance Week. So we are very thankful to Dr. Rajiv Singh Raghuvanshi for this cause of second National Pharmacovigilance Week. We also extend our gratefulness to our PVPI experts who were available on all the 6 working days during the second National Pharmacovigilance Week, and they shared their experience with us and benefited all the audience. I also would like to thank all our panelists who are present today during the valedictory session of National Pharmacovigilance Week. The support provided from Santosh Medical College students and Dr. Saktiwala Gupta, under her supervision, all the students who witnessed today the valedictory function of second National Pharmacovigilance Week, we are thankful to all of them for performing an excellent Nukkad Natak at 2 places in city of Ghaziabad. We also put on record the in Ghaziabad. Without their full cooperation and support, it was not possible for us for conducting a huge walkathon in which more than 200 participants from IPC, from RKGIT, and from Santosh Medical College students, they were present. So we are very grateful to all of them. When we released the annual performance report of the PVPI and the PVPI quarterly newsletter, we were thinking that it will not be possible for us in such a short span of time, but the support provided by the stores department, Manoj Pandey and his team, is acknowledged, and they showed that it is possible to take such challenges, and they stood to the expectations, and without their support it was not possible to release the annual performance report of the PVPI and the newsletter of PVPI. We also got the support from Material-Vigilance Program of India. So all the officials, they are sitting in front of me, and the support from Hemovigilance Program of India, from National Institute of Biologicals. And yesterday itself, when I just sent the pamphlet of the Pharmacovigilance Program of India to the director NIB, so he immediately responded to it. As it was Hindi version, so I got very nice comment in written from him, and his comment that it will increase the outreach of all the three programs of the Ministry of Health and Family Welfare, Government of India. So we are very thankful to the director NIB, Dr. Anup Anvikar, for deputing their officers at IPC during the inaugural session of the second National Pharmacovigilance Week. We also got the support from Pharmacy Council of India, and on the inaugural day, President Pharmacy Council of India was present in person, and he had sent the letters of sensitization on behalf of National Coordination Center for PVPI to all the pharmacy academic and research institutions in the whole country. So we are very thankful to Dr. Montu M. Patel and Dr. Archana Mudgal, Secretary, Pharmacy Council of India, as well as our former colleague, Mr. Ashish Kushwaha, who was also supporting for the cause of the PVPI. The support received from World Health Organization team for giving us the good speakers during international webinar on utilization of VG flow data and signal detection yesterday for Southeast Asia regional countries. So we also put on record the appreciation to the expert from Uppsala Monitoring Center at Sweden and World Health Organization, Geneva, Switzerland. The AMCs are the backbone of the Pharmacovigilance Program of India, and the support provided by the coordinators, the deputy coordinators, the pharmacovigilance associates is gratefully acknowledged, and I hope that in the time to come, they will enhance the reporting of the adverse event, and they will also assist in identification of the unlabeled drugs, unlisted drugs, or the potential signals. So I request my team to be in touch with the pharmacovigilance associate posted at those AMCs to get their inputs. The support provided by the Chief Medical Officer Ghaziabad, Dr. Bhavtosh Sankdar, is also gratefully acknowledged, and We met him a few days back. So, without any delay, he immediately sent our request through his letterhead to all the concerned institutions under his jurisdiction. So we are very grateful to the CM of Ghaziabad. The short audio-visual film which everyone has seen has been prepared by the IT team at National Coordination Center for PVPI along with other officials of the IPC. So my special thanks to Mr. Tarun, Mr. Abhishek, Mr. Rishi Kumar, and the whole team of the PVPI and MVPI for making this program a grand success. And I witness my officers sitting with me, Dr. Sashi Bhushan, Dr. K.K. Singh, Mr. Vipin Sharma, Shilpa Bhardwaj, Neha, Rishi Kumar, Dr. R.S. Ray, and Anusha, Madhu, Bharat, and many more officials who provided the full support for the success of this program. And I hope that they will continue to provide this support in future as well. Anchoring done by the PVPI staff and MVPI staff during the whole week is also acknowledged. And if they have or anyone has noticed some deficiency, we seek for their valuable feedback to take the corrective measures in future, preventive measures in future, and the corrective measures at the moment. At the end, it comes to my mind, there is a quote by Robert Frost, which I just changed two words. The quote is, "The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep, before I sleep." If it is in the individual capacity, but conducting the National Pharmacovigilance Week-like event, a single person cannot do it. And it requires the team effort. And instead of I, if we put we there, that woods are lovely, dark and deep, we have the promises to keep, and we have miles to go before we sleep. I think the dream which we realized, it will be fulfilled in future, and we will see that the safety of medicines is ensured not only for Indian population but for the whole world, and everyone will look at us, and the overwhelming support throughout the program from all our experts and the PVPI team is gratefully acknowledged. And let us give each of them the standing ovation. And with this, we come to the end of this program. Thank you, everyone. Now we invite all of you to join us for high tea followed by lunch. We are missing our expert. We are missing our audience who are connected with us. And thank you one and all.